So our first speaker, Dr. Lorie Donelle, is a scientist with the Lawson Health Research Institute in London, Ontario, and an associate professor with the Faculty of Health Sciences at Western University. She's jointly appointed to the Arthur Labatt Family School of Nursing and School of Health Studies. Dr. Donelle's primary focus is in the area of health promotion, and her teaching and research are specific to issues of health literacy, social justice, and the use of information technology within healthcare. Her research explores the concepts of health informatics and the relationship between health information technology, for example, social media, mobile health and e-records, and clients and clinician health practices. Paralleling this is her interest in health literacy and its influences on the health of individuals and communities. Dr. Donelle sits on the National Advisory Board for Health Literacy and Health Informatics within nursing and is a co-author with Dr. Hoffman-Goetz and Dr. Ahmed of a recently released book entitled Health Literacy in Canada, for which Irv did a fabulous plug at the end of his presentation. So join me in welcoming Dr. Lorie Donelle.
Thanks, Warren, and thanks, Irv, for the wonderful presentation. So it's going to make my job that much easier, and for the plug for the book as well. I'm sure sales will go up enormously as a result. So I'm going to focus today on the issue of health literacy and how I understand health literacy, and kind of share some of my thoughts with you, and hopefully contribute to a collective conversation around this idea of health literacy. I am going to talk particularly around the issue of numeracy, but I don't see the two things separate. So when I hear and when I see health literacy, I understand. And so my mental model is a combination of prose, numeric, and document, and perhaps other literacies as well. It's all working out. So the takeaway messages I hope that we have from some of our conversation today is a greater understanding of health literacy, prose and numeric literacy. I am going to reiterate some of the stuff that Irv talked about, but hopefully build on that in terms of looking at Canadian adult literacy skill and how that informs health literacy skill, again, prose and numeric. And hopefully provide a greater appreciation of the complexity of accessing health information, health services, and support, and offer a health literacy framework for you to consider. So I'm going to contextualize health literacy a little bit in terms of our contemporary healthcare system. And I think Irv has garnered some agreement that we really have moved from a curative paradigm of care to a chronic disease management paradigm of care. And the expectations with that, particularly from a consumer or a client perspective, are pretty significant in that there are expectations for self-care, for self-health promotion, and certainly an expectation for contribution to informed and shared decision-making around treatment and care management. And what underpins all of that really is access to credible and appropriate healthcare information. And so we have plenty of sources of healthcare information, and Irv talked about Ilona Kickbush, and this is adapted from one of her models. And she talks about us as individuals, citizens, also as clients, as patients, and certainly consumers, and that we have certainly a health literacy filter that we filter a lot of this information through. And certainly healthcare providers continue to be a really important source and resource for health information and services. Family and friends, in fact our pets, are really important sources of health support as well. The popular media, the mass media, has been significant, and we get a lot of our health information and general information from the mass media. For example, some of the popular magazines, television and radio, and some of the print publications in terms of newspapers as well. But I'm sure you can appreciate that more and more people are accessing the internet for information generally and for health information. And last time I checked, it was either the third or certainly within the top 5 reasons why people will go online. More and more organizations are having and establishing a presence online, and in some instances the only place you can get information is from an online source. And we'll talk about why that's a little bit troubling for certain individuals. And certainly in terms of some of the socially mediated opportunities to access health, not only within this participatory web or Web 2.0 or Health 2.0, not only are we pulling information from the internet, but in fact, we're actually co-constructing a lot of the information and the knowledge that's available to us with respect to health and health services. What the literature does suggest, though, is that depending on literacy and health literacy skill, we will tend to access some resources more than others. For example, individuals with low literacy skill tend to access the more passive resources, that being, for example, television and radio, and individuals with more sophisticated literacy skill set will access some of the more complex resources, for example, the internet. Oops. And it's not as if we don't have enough information. And if anybody, I'm sure, I can't imagine there's one person in this room who hasn't said that they were going to do a 5, 10, 15-minute internet search for something, and an hour later or an hour and a half later, you're still there jumping from link to link to link to link. We have all of this information, which is good and bad, right? It's good that we have all of this information. It's somewhat troubling for some people in using that appraisal or that critical analysis in terms of what's good information, how do we discern the good from the bad, and what's appropriate, all to inform decision making. So accessing information is not so much a problem, but the question is, do we really get it? We can get a hold of it, we can physically get our hands on it, but access also means the comprehension piece. So do we really understand that? And what feeds into that, and Irv talked about some of this, are the literacy skill of Canadians. And Irv mentioned the international, and I'm going to speak to the Canadian assessment in terms of prose, document, and numeric literacy skills. And what the latest assessment really spoke to is some troubling information in terms of about almost half of our adult population, so individuals 16 and over, have difficulty in terms of prose, excuse me, and document literacy skill, in that they function below the minimum or the expected literacy level. It's even more troubling in terms of numeric literacy, in that certainly 55% of Canadian adults will be particularly challenged in terms of working with numbers, and in some of the conversation that I've had with people here, this idea of risk and understanding that. I want to take a minute to kind of contextualize this idea of literacy skill and the importance of that, and really pull on some of the expertise from education in the literacy field, and certainly provide a broad perspective. So there's certainly an error of, or a margin of error here. But when we look at education from kindergarten to grade 3, the focus of literacy is really learning how to read. And so it's the process of, and the cognitive work of decoding words, putting together sentences, and to being able to understand what the words mean. It's important to have that foundational skill in terms of what happens afterwards in some of the subsequent years, where we're really reading to learn. And that's a really important shift. And it's important when we begin to think about health literacy. It's not that we're not continuing to decode terms and words, but we're also having had that foundational skill in order to challenge and question, to make some connections, and to begin to develop some of those mental models. Those mental models in terms of what is a disease process, what does or what constitutes HIV, and have that in our head. And so I'm going to pull on that again later on. So let's move from literacy and contextualize that into the healthcare context. And you're going to laugh because here I go again, right? I was just saying to Mark when at the break, we're either very flexible and accommodating as a group, or we just don't have a clue and we can't get our act together in terms of a definition. So I've put some effort into reiterating some of the same information that Irv has provided, but wanted to highlight a few things and variables principles that I think is really important before we kind of move on with this. So health literacy, this is kind of a mashup of a number of different definitions as well. So I wanted to, again, identify the fact that there's cognitive and social skills, and literacy and health literacy sits within a social context. We construct our social experience. And it talks about the motivation and the ability of individuals, and Irv really spoke quite eloquently to this, the fact that when I see individuals in this definition, I understand them as being patients, clients, consumers, also the provider side, and certainly organizational. And I was interested in the question with the previous session around organizational health literacy and the navigational piece. And I think we have some serious work to do in terms of some of the organizations that we sit within in terms of being organizationally health literate. I'm sure we'll have some conversation around that. But it is the individual's ability to access, understand, so get a hold of, comprehend, appraise, that critical appraisal piece, and communicate information. Information being prose, numeric, document, and perhaps other literacies to promote, maintain, and improve health in a variety of settings across the life course. Already, I'm getting the halfway mark already. And all of this sits within a cultural context, and I'm going to, again, pull on that in a little bit. Irv talked about the fact that 60% of Canadian adults have challenges in terms of their health literacy skill as well. And he talked about as well, very nicely, the research, what the research is telling us with respect to that. And I'm going to highlight a couple of things that I think is really relevant and would resonate with sexual health and gay men's health in particular. This idea, and HIV/AIDS, and this idea of individuals with low health literacy and low literacy skills certainly experience significant amounts of shame. And what that is concerning is that there's a certain stigmatization, so kind of a compounding of stigmatization if we look at HIV/AIDS and lack of literacy. This tends to either silence people so that they don't contribute and won't contribute to some of the healthcare decision making, and extend an experience of isolation, which is quite troubling. Individuals with limited health literacy have limited health vocabulary. They can't speak to the issues of HIV/AIDS. We have assumptions that we make that people will come to us as clients, us as providers, and that they'll be able to speak to some of their symptoms and their experiences, and perhaps are making assumptions about that. Limited knowledge of anatomy, limited understanding of chronic disease generally, and certainly limited access to certain sources of health information, which, as I said, can be quite troubling if, in fact, some information is only available within an online setting. Individuals with low or limited health literacy tend to have late-stage diagnosis of disease, and Irv talked very nicely about the increased utilization. Relative to individuals with higher health literacy, there's about a 2 and a 2.5 increase in hospitalizations and emergency services use. So I really would welcome you to consider the impact of limited health literacy, certainly on patient engagement. Why aren't people interested in their care? Perhaps they are, but for other reasons they are choosing not to, or don't feel that they can. There's a real issue around equity, who gets included and who gets excluded, and I think we need to pay attention to that. So let's get to the health numeracy piece. There's a group in the US that has created a definition and a model of health numeracy, and they talk about health numeracy as the degree to which individuals, and you're going to recognize some of the same terms, have the capacity to access, process, interpret, communicate, and act on, so there's a behavioral component, numerical, quantitative, graphical, biostatistical, and probabilistic health information. They covered everything, to make effective healthcare decisions. It is about making those good decisions for ourselves and collaboratively with others. They have framed health numeracy into 4 broad categories of basic, computational, analytical, and statistical skill. So basic skill is really about number identification. So for you sitting in the audience, can you recognize that there are 3 pills in that image with the pill container? Would you be able to follow the instructions, take 1 pill 4 times a day? And even that doesn't have enough context and direction to it in terms of instruction. The computational health numeracy really speaks to relatively simple arithmetic and computational acts. And so, for example, using the nutrition label, would you understand that 2 servings of that particular food substance constitutes 220 calories, 20 grams of both sugar and protein? The analytical health numeracy really speaks to our ability to interpret and to contextualize numbers. Numbers are only numbers, so 120 over 80, for someone who doesn't have a healthcare background, wouldn't be able to relate or associate that with perhaps what would constitute a normal blood pressure. So it's the ability to put into context some of these numbers, and also from multiple sources. So, for example, if you were assessed as having a blood sugar of 6.5, would you recognize that within a reference range of 4 to 7 that was normal or not? And then what action would you take if it was or it wasn't? And lastly, statistical health numeracy really speaks to our ability to understand some of the biostatistical information, the epidemiological information. Do we understand this idea of life expectancy, of probability? These are really challenging concepts. Can you take from some research literature and understand the concept of relative risk, of the number needed to treat, of odds ratios, that kind of ability? 5 minutes. I think I can do it, Warren. In terms of the evidence of competency with respect to health numeracy skill, it ranges anywhere from the studies that I've certainly identified as 26% to 71%, depending on the population, depending on the measurement used, of individuals with inadequate health numeracy skill. We're not exempt. We don't get out of this equation in terms of providers. There's been some really interesting research done around the challenges that as providers we have with respect to the statistical health numeracy. And that's a concern in that if we're not interpreting that information adequately and appropriately and passing that misinformation then on to our clients, that's problematic. There was a study done as well with, I think it was 1st or 2nd year medical students, where they were assessed in terms of basic numeracy skills, and almost a quarter of these individuals scored as having limited skill in that particular area. So we've got some work to do there. The research around health numeracy really speaks to individuals with limited skill have challenges just in terms of maintaining their appointments. So when people don't show up, it's perhaps not because they're not interested, or if they don't take their medication properly, it's perhaps not that they're not being adherent. It might be that there's some challenges in terms of numeracy. There's difficulty, and certainly Warren and I were having a bit of a chat about this in terms of understanding this idea of risk. Individuals with limited literacy and numeracy skill really have challenges in terms of assessing and then personalizing this idea of risk and probability, and have then limited or lesser appreciation for some of the prevention strategies and some of the screening strategies that are available. Medication errors much more in terms of individuals with low numeracy skill than those with higher, and implications for self-care as well. When Mark and I were talking about this session and getting together, he said you were a great group, that you love to chat, talk, discuss. So I'm offering my thinking out loud opportunity and really wanting to contextualize and make sure that we don't forget about the broader context in where, in this example, health numeracy sits. So even though we've got this framework around basic computational, analytical, and statistical health numeracy, it really sits within a broader context. And so this is my thinking out loud for you, and you can challenge me and contribute, and we can add to this list. But I think there's a temporal aspect to this as well. It's important to recognize who are the novice patients versus the expert patients. The information needs for someone at the time of diagnosis, often in almost across all diseases, is very different than the information needs of someone who has quite a lived experience with the disease. And we can layer the complexity, and I've offered a few possibilities, this idea of learning to read. If that's where our focus is, then a lot of our cognitive work is being taken up with that, rather than reading to learn. And the diversity of information, just the sheer volume of information, again, good and bad. Great that we've got that opportunity to pull on a lot of the information that's available. Challenging in that we have to be very discerning and discriminating in terms of the information as well. You're making me nervous with your, he's making me nervous with the numbers. There's multiple diseases, comorbidities, you get that, and then also layer that with the number of treatments, and the treatments that are still in question and being tested and being researched. Culture, we're witnessing the impact of culture on health literacy, or the opposite. When we look at what's happening in Africa with Ebola, and that is really a cultural spread of that disease more than anything else. Language is another important part of culture, whether it's English, French, German, Japanese, Chinese, or if we're using that medicalese, and expecting that a totally different culture will understand our world. And I'm learning a whole new culture around the language of text messaging in order to be able to communicate with my children. Through text messaging, I'm not a digital native. I'm like Irv. I'm relatively new to this game. And so it is an entire culture. So culture can be taken up in a lot of different ways. And all of this contributes to our mental models of understanding. Concepts in terms of, I suspect very strongly that my understanding and my mental model of health perhaps differs from what exists in the audience. The idea of my understanding of the immune system, of certain disease processes. And Warren and I were talking earlier, this idea of high risk. What does that mean to you? Yes, you're at very high risk for that. Thank you very much. And people will walk away and say, yes, of course I understand, because that's what patients do, right? They agree with us. I'm going to finish up. Have you got a zero? I'm time's up. I made it under the wire. But I think health literacy skills are foundational. They're foundational in terms of not just the numeric skill, but the prose skill, the document skills, and I know there's others that we can add to the list. And they really inform our ability as clinicians, but also our ability as clients and consumers, our ability to self-care, to self-help promote, but also to feel confident in participating in that shared decision-making around what happens to us and about us. And I like this quote, and I'll leave this with you. When the demands exceed the requisite skills, patients may feel overwhelmed and retreat into silence or stop actively participating in their own care. And that's what we're trying not to have happen. And I think health literacy is certainly a component of enhancing self-care and that continued conversation. And we're waiting for questions. Thanks, Warren.